This is my video for local anesthesia risks and benefits, and my patient today is going to be Nutmeg. I finished crocheting him just about a week and a half ago, and I think he is just so stinking cute. So I'm gonna have him be my patient today just so that I have something to look at while presenting my information. So here we go. All right, Nutmeg, so today you are receiving non-surgical periodontal therapy in one or more quarters or quadrants of your mouth, meaning that you are a great candidate for receiving local anesthesia today. So the purpose of providing local anesthesia is to reduce any discomfort that you might have during the procedure, making it an overall better experience for you. And how our anesthesia works is it will temporarily disrupt your nerves from telling your brain that something going on in your mouth might be hurting, okay? So some benefits do include controlling and reducing any pain that you might have during the procedure. And also, we are going to control that pain without the use of general anesthesia, meaning that it's going to be a much safer procedure for you, okay? However, there are some risks, including soreness at the site of injection, maybe some numbness or tingling, just a general loss of feeling at the site in your mouth. And that means that for lunch or for dinner today, I don't want you eating anything super hot, anything super crunchy. I don't want you to burn yourself or accidentally chomp on your cheek. So a great option for lunch might be a smoothie or maybe some room temperature soup, okay? Also, a rarer risk is an allergic reaction, but we do know how to manage that should it occur. But again, it's very rare. Some other rare risks do include a hematoma, which is basically a fancy way of saying a bruise. But in order to prevent this, I'm going to apply firm pressure for about 15 or more seconds after every injection. Also, nerve damage that lasts significantly longer than how long we expect our anesthesia to have effects. So, and I mean like days of numbing and tingling. And then also trismus, which is, again, a fancy way of saying locked jaw. And that's basically just not being able to open your mouth as much as normal, okay? However, I am going to have my instructor assisting me today, and we have been learning how to safely provide these injections all semester, but I do understand it's a very scary procedure, especially if it's your first time. So if you have any questions for me, I'd be happy to answer them. Alrighty, that's my video. Thank you.